Study something until you become a neonatologist. So we're going to talk about hypoxic ischemic encephalopathy, or HIE, which falls under the umbrella term neonatal encephalopathy. So there are other conditions that can present like this, but HIE specifically, there are certain criteria that we look for that may have happened around the delivery to say that this infant may get the diagnosis of HIE and receive the subsequent treatment. So HIE is a birth complication that can affect 1.5 to 2.5 per 1,000 live births, or about 7,000 babies per year in the United States. So these infants are at risk for long-term issues, including cerebral palsy and severe disabilities. Most of the research in HIE is looking at preventing subsequent brain injury. While the exact cause isn't always identified in every case of HIE, there are some things that can happen around birth that would make us more suspicious for it. So if there is a cord prolapse, placental abruption, maternal hypotension, placenta previa, perhaps a baby's breech and we didn't know and is trying to deliver a breech, or if there's a shoulder dystocia. So any of those scenarios in which there may be decreased blood flow from the mom placenta to the baby means the baby's not getting that oxygen, so they are at risk for HIE. So there are criteria and lab work that we look at to decide whether or not this patient may qualify for what's called therapeutic hypothermia, which is lowering the infant's core temperature to try and protect the brain. So we know that there may have been some damage done because there was a period of time where the baby did not get adequate oxygen. So the goal of hypothermia is to reduce free radicals, glutamate levels, decrease oxygen demand, and decrease apoptosis. The infants are cooled for 72 hours, and then after the 72 hours, they're rewarmed, and then we get some imaging of the brain to look at the extent of the damage. A lot of the research is looking at preventing further damage that may have already occurred. And then as an outpatient, these babies often will see PT, OT, speech, developmental, just to make sure that they have all the resources that they need to thrive once they go home.